Understanding the ApoE gene, Alzheimer's risk, and early detection strategies. The ApoE gene, also known as apolipoprotein E gene, plays a significant role in the development and progression of Alzheimer's disease. The gene is responsible for producing apolipoprotein E, a protein that helps transport cholesterol and other lipids throughout the body. In the context of Alzheimer's disease, the ApoE gene has been shown to influence the formation and clearance of amyloid beta protein plaques, which are a hallmark of the disease. ApoE has three major isoforms, named ApoE2, ApoE3, and ApoE4. These isoforms are coded by three alleles, epsilon-2, epsilon-3, and epsilon-4, respectively. The distribution of these alleles in the population is roughly as follows. ApoE3, epsilon-3, the most common isoform, found in about 78% of the population. ApoE2, epsilon-2, the least common isoform, found in approximately 7% of the population. ApoE4, epsilon-4, found in about 15% of the population. The ApoE3 allele is considered to be neutral, meaning it does not seem to increase or decrease the risk of developing Alzheimer's disease. However, the ApoE4 allele has been strongly associated with an increased risk of Alzheimer's disease. Individuals carrying one copy of ApoE4 have a 3 to 4 times higher risk of developing Alzheimer's, while those with 2 copies have up to a 12-fold increased risk. Conversely, the ApoE2 allele is associated with a reduced risk of developing the disease. To prevent or reduce the risk of Alzheimer's disease manifestation, particularly for individuals with the ApoE4 allele, a combination of lifestyle modifications and medical interventions may be considered. Some preventive measures include healthy diet. Consuming a diet rich in fruits, vegetables, whole grains, and lean protein sources, such as the Mediterranean or DASH diet, may help lower the risk of Alzheimer's disease. Regular physical activity. Engaging in regular aerobic exercise, such as walking, swimming, or jogging, may improve brain health and reduce the risk of Alzheimer's disease. Cognitive stimulation. Participating in mentally stimulating activities, such as reading, playing board games, or solving puzzles, can help maintain cognitive function and potentially slow down cognitive decline. Sleep hygiene. Ensuring adequate sleep and addressing sleep disorders, such as sleep apnea, can contribute to better brain health and reduced Alzheimer's risk. Social engagement. Staying socially active and maintaining strong relationships with friends and family can help promote overall mental well-being and potentially reduce the risk of cognitive decline. Management of cardiovascular risk factors. Maintaining healthy blood pressure, cholesterol levels, and blood sugar levels can help protect brain health and lower the risk of Alzheimer's disease. Avoiding smoking and limiting alcohol consumption. Smoking cessation and moderate alcohol consumption may help reduce the risk of Alzheimer's disease. Early identification of individuals carrying the ApoE4 allele associated with an increased risk of Alzheimer's disease can be achieved through genetic testing. Genetic tests typically analyze DNA from a blood or saliva sample to determine the presence of specific gene variants, including the ApoE alleles. There are several methods of testing for ApoE genotypes. Direct-to-consumer, DTC, genetic tests. Companies such as 23andMe or Ancestry DNA offer genetic testing services directly to consumers, which may include information about ApoE genotypes. However, the level of detail provided may vary, and these tests are not typically focused on assessing Alzheimer's risk. It is essential to exercise caution and consult with a healthcare professional before making decisions based on DTC genetic test results. Clinical genetic tests. A healthcare professional may order a genetic test specifically for the ApoE genotype to assess an individual's risk of developing Alzheimer's disease. This type of testing is typically more accurate and comprehensive than DTC tests and can be performed in a clinical setting under the supervision of a physician or genetic counselor. It is important to note that genetic testing for Alzheimer's risk has limitations and ethical considerations. Genetic testing may cause anxiety or distress for some individuals, and it is crucial to weigh the potential benefits against the possible emotional and psychological impacts. Additionally, there is currently no cure for Alzheimer's disease, and the available treatments focus on managing symptoms and slowing disease progression. Therefore, knowing one's genetic risk may not significantly change the course of action for prevention or treatment. Before undergoing genetic testing for Alzheimer's risk, individuals should consider speaking with a healthcare professional or genetic counselor. Consulting with a professional can help individuals understand the implications of genetic testing, interpret the results, and develop an appropriate plan for prevention and monitoring. Evaluating the potential psychological impact. It is important to consider the potential emotional and psychological consequences of learning about one's genetic risk for Alzheimer's disease and whether this information would be beneficial or harmful. Considering privacy and discrimination concerns. Genetic information can be sensitive, and it is crucial to understand potential privacy concerns and the risk of genetic discrimination, especially in the context of employment or insurance. Overall, early identification of individuals with the ApoE4 mutation can be helpful in guiding lifestyle choices, monitoring cognitive health, and possibly participating in research or clinical trials aimed at developing Alzheimer's prevention strategies. However, it is essential to approach genetic testing with caution and consult with a healthcare professional before making any decisions.